Leah. Leah, how are you? So Leah, we're doing the local anesthesia lift, and let's see if we, uh, let's see. I want you to, Alex, don't flip her paperwork on, but if you flip her paperwork, you can show her pictures. You want to flip that paperwork and then, there you go, flip it around and you can show her pictures. So here's Leah, wonderful, dynamic person, living her life, and wants to look a little more youthful, and we are honored to take care of her. Do you feel a little bit of a pinch there, or not really?
No.
Very, very good. So right now, I'm just trimming some of the fatty tissue. This is preparing for the platysmoplasty. For my physicians and students that are watching, this is all local anesthesia. This is the safest way to do a lifting procedure. If there's any questions, Alex, just let me know, okay? We show pictures of our fillers and videos, and Leah said she wanted to see video of herself, so we said, all right, let's get Alex in here. So Leah, you're gonna watch your own video? Okay. Well, say hi to Leah, because Leah's gonna be watching. Okay. So most patients are unaware that this can be done. They say, oh my goodness, I'm going to be awake. You're going to be relaxed with the relaxing medicine. You'll feel comfortable. And that's the way we do it. You're very comfortable. You can't feel what I'm doing. And this is to tighten up the neck and the jawline. Everything's looking good.
That's what I like about you.
Say again?
That's what I like about you. Everything is good.
Yes. So I've been practicing. I've done over 4,000 facelifts under local anesthesia. And most doctors retire after doing 500 or 1,000 facelifts. So we are a facelift center of excellence. We don't do anything for the body or anything below. Sometimes when you do the lift, if you pull really, really tight like this, sometimes it gets a little tightening down here. I'm just kidding. Can you switch those over for me, please, Jamie? We only focus on the face. And that's what our patients want. They want someone who does more than everyone else. Most other providers, they've done 5 or 10% of the numbers of treatments that we've done. So that's what sets us apart. If you want your plan, give us a call, 813-463-9245, or email us. We can do virtual consultation, face-to-face. We have our seminars, which are very informative, and they're fun. We have a lot of fun at our seminars, and we have the best patients. Leah, you came to our seminar.
Yes, sir.
Did you like the seminar? Was that helpful?
Yeah, there was. I was ready.
You were ready. How long had you been thinking about it for?
Since I was 40.
Since you were 40, huh? Oh boy. Well, today is a special day.
65.
Good for you. But I'm curious, why? Why did you want to do a treatment, Leah?
I went to rough time watching mother-in-law, grandkid, mother-in-law dementia. That took a lot of toll.
Oh, wow. You're an angel. When you're a caregiver, you're an angel. Because it's not easy. Not easy being a caregiver.
I told my mother, this is your, this is all her.
This is all heart, huh? So I use a little bipolar cautery. It just cauterizes the blood vessel. Everything's looking really good. How are you doing, Leah? You doing okay?
I'm doing awesome.
Good. So now that I've trimmed a little bit of the fatty tissue, I'm going to put a little stitch in the middle. It's called a corset platysmoplasty. Make sure you're following and make sure you share this with a friend. If they're thinking about having something done, do you feel a little pinch there?
No.
Alex is our award-winning camera person. We have over, thank you very much, Alex. We have over 30 staff here dedicated to your care.
I want to keep Jamie.
You want to keep Jamie, huh? She's great. Jamie's the best. I feel like I'm on vacation every day. My team takes such great care of me, like I'm at the Ritz-Carlton. And they take great care of our patients too. And in a couple of weeks, we're going to be in our new office. So excited about that.
Oh, yeah, where?
It's on West Del Prado near Manhattan. It's about 10 minutes from here. We'll send out the announcement. You have to come to the party. But we got to get everything settled in. It was a big project, boy, but they did such a beautiful job with that office. It's just amazing.
I'm not from here.
About 10 minutes, 10-minute drive. It's close by. It's just a few minutes from the interstate, so it's a good location.
Off of the airport.
It's a little closer to the airport. Everything's looking good. So I bring those edges of the muscle together, and that tightens up the neck. You'll feel that get a little tighter there. While I'm doing that, I'm just going to trim just a little. I like to fuss over little details, so I see some of the fatty tissue, and I'm going to trim that just a little bit, not that much. You see, I don't know if you show them that there. You can see that's what we trimmed. Perfect. So all techniques got better doing general anesthesia, but today nobody wants general anesthesia. They don't want the risk. They don't want the expensive general anesthesia. They don't, there's risk. They have the reports of risk of dementia with general anesthesia. This is the safest way to do it. And most patients say we're easier than the dentist's office. Everything's looking good. So once I tighten here, then I'm going to go around in front and behind the ears, and we'll tighten in those areas too. And then a couple months, but you can come to the office for your follow-up. But most patients say, no, I'm fine, and they recover at home, and we're available for cleaning. So there's physical versus social downtime with the lip. Physically, people get socially, we pass the grocery store test, where you walk into the grocery and no one does a double take. That's about 7 to 10 days. Some are faster with their recovery, some take longer. Everyone's different, and we'll get you through as quickly as possible. Perfect. So now that we've done the platysmoplasty, I will surveil the area and look to see, do I need to trim a little more tissue? One step at a time, always fast, but never hurry. Okay, let's take a look over on this side. So now that I've done that tightening, it gives me a little bit better exposure for my physicians and students that are watching. And then I'll go back and maybe trim just a little bit more. Traction, counter traction allows me to get into the correct tissue plane.
It's so cool,
Thank you. I've been practicing. You get the hang of it after 4,000. And then the other thing, can you go ahead and release for me, please, Jamie? So I love that. Look at that. It's so defined and contoured, but I'm going to see a few areas I'm going to pay attention to here. Very good. If you feel a pinch, you let me know. I'll put some numbing medicine, okay? Are you feeling any discomfort or no?
No.
Okay, very good. Now let me see over here is where I want to do a little more yet. So this is an area where we have a little bit of the gel, so I'm going to trim that tissue and sculpt. This is called liposculpting.
Oh, that's what it is.
Well, that's what I'm doing right now, sculpting the fat. We did the laser.
I saw that.
Very good. And we're staying, for my physicians and students that are watching, we are superficial to the platysma muscle here, so that keeps us safe. Make sure we get the best results. And right here, that's good. Thank you. I'll do a little bit of cautery. This cautery, it seals the blood vessels. As you can see, there's really very little bleeding because we cauterized the blood vessels. Feel a little pinch there?
No.
If you feel a pinch, you let me know. Very good. Okay. We have office in Tampa and the Villages, Florida. And I think we have a seminar on. Do we have one
Tomorrow.
Sun City.
We're in Plant City? Where?
Sun City.
Sun City. So if you're in Sun City, we'd love to see you there.
And then next Thursday at Brownwood.
At Brownwood in the Villages. Thank you, Alex, and thank you, Jamie. Perfect. Boy, this looks so good. Let me look on this side for me, please.
It feels good.
It looks good. It feels good. It is good.
When can I eat?
Well, there's no restrictions. Her question was, when did she eat? There's no restrictions on what you eat, but right after, you won't feel like doing heavy chewing. So, whatever you feel up to, but you can do liquids, and, you know, obviously it's going to feel very tight in the beginning, and then that eases up. So, you just eat what you feel comfortable eating. Okay, release for me, please. So I like what I see, but I'm not done because I'm going to still be pulling and tightening from this area. So now we're going to turn your head this way. Is that okay for you? Very good. And then I'm going to speak to this area here. And then later we're going to do some of the eyes. You feel pressure pinch there or not really? Very good. Thank goodness for lidocaine. A lot of my patients tell me, they say, wow, it was so great to watch the video. It helped me a lot, but the video is not for everybody to watch. Some people, they like that, but some people say, no, I can never watch that. How about here? Do you feel pinch? Okay, very good. You're forward for me, please. So the incision, it hides right behind the hairline here. And I'll show you the eyelids in just a moment, but first we're going to tighten through here. Very good. Thank you for watching. Thank you for sharing. We're honored to be your Facelift Center of Excellence and Filler Center of Excellence. You get the hang of it after thousands and thousands. We have the best master injectors. They're so good. And this is really artistry, what we're doing. To look your best and feel your best. And you must look natural. And you will, we guarantee it. Perfect. Everything's looking good. Okay, release for me, please. So, traction, counter traction for my physicians and students that are watching. Traction here, counter traction with the tip of the scalpel rather, that's not the scapula. I worked out my scapula this morning with my shoulder shrugs and my lips. So this is the scalpel. Very good. So we like to talk to our patients about the ABCs of plastic surgery. The ABCs are very important to know because when you know your ABCs, you make your best decisions because you understand the bigger picture. We go through this in our seminar. A stands for area. There are 4 areas. If you want to improve your facial appearance, there's 4 areas we address. Number 1, if we sag, we tighten. Number 2, if we lose volume, we fill. Number 3, sun damage, wrinkles, and sunspots, we can polish and repair the skin. Fourth area is better than everything else. That's our behavior. None of our treatments look as good as Mother Nature's free facelift when we smile. And Leah's a great smiler. She's a great smiler. She's very generous with her smile. So those are our areas. Now B is our boundaries. These are the rules that we abide by to make sure that things are good for you. Number one, safety is always first. Number two, you must look natural. Number three, we help prevent the show of future aging changes, which is very powerful. If we're lucky, aging keeps coming for all of us, better than the alternative. So prevention is key. And number four, let's get as much improvement as possible, but we can't make things perfect, right? We're not God. We do the best we can. And if you need to come back another day and do more, that's better than going too far. A for area, B for boundary, C stands for combination treatments. If we want our best results, we combine tightening, volume, and skin. Best the lift like we're doing now. Best result, no downtime, is filler. And it's just 3 different categories of treatment. And it makes things predictable, you know, because fillers, they don't give you the same result as a facelift. We all know that. And even though we get great results with our lift, if I do fillers or combine other treatments, I can still do better. So the artistry of the face, it's important to understand combination treatments. And then D, ABCD, stands for different perspectives. We never see ourselves. Do you feel a little pinch there or no?
Okay.
Very good. I'm always asking, make sure patients are comfortable. D stands for different perspective. We never see ourselves the same way other people see us. Even though we're looking at the same thing when we look at our face, but why don't we see it the same way? Because when we look at other people, we look at them socially. We smile, we move our face, we animate. When we look at ourselves in the mirror, we don't look socially, we look seriously. We can be hard on ourselves, makes us feel bad. That's the reason people go too far with their treatments. They're too hard on themselves. And we're not going to let that happen here. So that's why we like to talk about it. So those are the ABCs of plastic surgery. So I use a 2-0 Ethibond and lift for me real tight. That's good. And we're tightening up the SMAS. This is called a SMAS plication. So I grab the SMAS distally, just anterior to the angle of the mandible, then preauricular in the parotid fascia, anteriorly again, and auricular again. Thank you, and then I will take a 2-0 Ethibond, please, thanks. So, we're tightening things up here, Leah.
Yes.
That's what we're here for. We flash the suture. That allows us to tie it down under tension. You see, Jamie knows everything. I don't even have to tell her what to do. She just knows what to do next. Makes it so easy for me. Thank you. Can I have a little bit of the Hibiclins on the tray?
Of course.
Thank you.
No problem.
And then I'm going to put a little over here. Thank you.
You're welcome.
And then this is infra-auricular, and I'm going to suspend this post-auricular. Surgeon's knot. Jamie Washington. Feel it get tight there, Leah. You doing okay?
Mm-hmm.
Very good. Thank you again, Alex, for videoing today, and thank you, Jamie, for having everything set up so perfectly. It makes it really, really easy for me. Perfect. And now, when I'm preauricular, what I like to do is I like to use the 2-0 Vicryl to suspend the SMAS in this area. Let's see where that put mine. There it is. And a little bit of gauze. As you can see, there's really very little significant bleeding. There's almost none right now. Leah's being such a great patient. So local anesthesia facelift. You don't need a full traditional facelift. There are doctors that they remove glands and muscles from the neck to sculpt the neck. I just don't think that's necessary. I don't like to recommend that. Very good. So we mix things up today because sometimes we do this on a tripod, but it's helpful too. We want to make sure the viewers see a person carrying the video because it does add a little element to the video. We want to make sure you guys can see a little different angle. And I'm going to... So measure twice, cut once. I agree. Thank you. Perfect. So I free up the lobule, that's the earlobe, a little bit. That allows me to make sure that there's no tethering. And we get a good estimation of where the skin is going to drape down. So now I trim this little bit, and I may trim it again once it's all laid down. And behind the ear, we're going to trim a little extra skin here. I'm going to free this up a little bit, undermining the skin flap. This is a rotational flap. There's some doctors that they say, well, they don't make the incision straight in the ear behind like that, but I've done that for a long time and it seems to work just fine. It's all artistry and, of course, experience and great patients like Leah. People are living much longer, looking better. So that sits down very nicely. So now, one more time, I'm going to look to see is there anything that caught her eyes. So Amy will hold exposure for me and just a little cautery around the earlobe, or as we have to come up with a name for everything, we call that the lobule. And the incision in the hairline here, that hides very nicely. So, looks super. And behind the ear for me, please. And so sometimes there's what we call little dermal bleeders that we trim, that we cauterize here, but there's really nothing to cauterize. And now I'm going to do a deep suture to bring the skin edges together. I use a 2-0 Vicryl for this. And there's a little cautery I'm going to do just in this little spot. Sometimes it's from the skin flap, sometimes it's from this. There you go. Okay, so now I'll show you how I do the numbing for the upper eyes here in just a moment. You've already marked out the area. The way I do eyelids is a little different. Traditional eyelids, they take skin, muscle, fat from everyone, but that's not necessary. And as we get older, we're going to lose volume around the eye. So I like to preserve the muscle and preserve the fat when I do the eyelid treatment, the blepharoplasty. And so it's less invasive and less recovery. So I save the muscle, I save the fat. And it's just one stitch to treat the upper eyes. Thank you for helping out there. She's exposing my little knot. Good. And trimming on the knot all the way down. That's great. Anterior to the tragus and then post-auricular. Suspension suture here. And then to the skin flap, which just comes together so beautifully. Perfect. Thank you for watching. Thank you for sharing. We're a certified facial, plastic, and reconstructive surgeon. We have 2 Wall Street Journal best-selling books. We guarantee we can make you look younger. Look us up on Amazon under my name, Rich Castellano, and the Smile Prescription. And if you're up in the Villages, one of the largest retirement communities in the world, We've got an office right there to serve your needs. And we're hiring. We've got over 30 staff dedicated to patients, and we can't keep up with the demand, so we need more team members. Thank you. And then I'll take the lidocaine after this. So this is the tragus, that little bump in front of the ear, so I keep the shape of that. You retain some of the shape there. That's perfect, and around the lobule. So when I do this, I'm just measuring how that sits down so nicely under zero tension. And we'll trim just a little bit of skin right here so that everything fits together perfectly. Wonderful. So before I do the chromic, now I'm going to do a little bit of the numbing medicine. So you feel a little pinch, numbing medicine, 1, 2, 3, pinch. You feel small, medium, big pinch there, Leah, not too bad? If you're just now joining, we're here with Leah today. Can you show them her pictures? Again, where we're starting. Look at this jawline. What an amazing, your jawline looks awesome, but we're not done yet. We're not done yet. And we're going to do the eyelids as well. Perfect. So you see the pictures before, but look at this jawline. What a difference. You can show them the before and after, right? But so immediate results, physical versus social downtime after the lift. Physically, we get back into our routine within a day or two. Not 100%, but you can start there, Leah. Not too bad. It's a little bit of the numbing medicine here. Just a little bit, and I'm not in a hurry. Yeah, make sure Peyton's aware that it's 30 for everyone, all the time, no exception. Good. Perfect. Okay. Now, I'm going to use the chrome to close the rest of this, even though it already looks like it's together, but I do a nice little layer of, and can you help me out by pulling that together? Thank you so much. So just a little stitch here. I must have thrown about 1 million stitches in my life. And in my family, if somebody needs stitches, guess who gets a phone call? And I'm happy to take care of them. A lot of good stories. The cousins, my boys, my niece, nephews. I gave a talk at my daughter's school one time, and I asked them, it was I think her 3rd grade class, and I asked, how many people here have had stitches? And like 75% of the kids raised their hand. I'm like, oh my goodness. Everything's looking good. So very proud of Leah. She's looking great. I'm proud of Leah for making, this is a great decision to do this. She has many active years ahead of her. And patients tell me, they say they were not expecting how good this was going to make them feel. It really does give you a boost. And people do treat us differently based on our appearance, right? They treat us differently based on how young or how old they think we are, in our workplace, in our relationships. But the most important person that treats us differently based on our appearance is ourselves. And if you could pull that a little bit higher, Jamie, so it's not in the way. Thanks. Very good. So I do a little extra stitching around the earlobe to make sure it stays in place. I need to say that again. I'm done with the tightening on this side. We get right to it. We're going to do the eyelids. I'm so happy. It looks so good. Now, Leah already looked great before we did anything, right? But now it's going to look more youthful. And no one's going to figure out she did it unless she decides to tell them. Can you pull the earlobe forward for me, please? Thank you. Very good. So I put a few extra stitches here because when the shirt comes off and on, sometimes it can tug on the earlobe. So we bolster that little extra support. Perfect. Good. So now that I'm done with this little stitching part, we'll do the eyelids, and you'll see it's very quick and straightforward to do the eyes when you've done thousands of them. So I have 2 board certifications, Castle Connolly, voted top doctor, very proud to have all of our awards. But the best part of what I do is the patients we get to work with, and we have the best team. Really, when you meet our team, you'll see, I mean, they are really high quality people. They care. They are some of the nicest people you will ever meet. And whatever you do not make them angry. No, I'm just kidding. You know, they're human. I mean, don't do that for anyone, right? Don't make anybody angry. But we got a great team. I never see them, but I sure wouldn't want to. But they're great people. Truly family people, family oriented, and you can tell how much they care. I'm going to turn your head this way a little bit. And can I have a little bit of the light, please? And can you fill that up for me, please? You feel a little pinch here or not really?
I don't see anything.
Me neither. Everything's looking good. $15, please. So I'm going to turn your head this way just a little bit. So I've already marked out the area. Thank you so much. Ms. Paola shifted from Alex. Perfect. So we make the incision line, then I'll take my tenotomy, please. Okay, so traction, counter traction. So we pull. Yeah, just this morning we were at the new office. It's so good. And even since we've been there, somebody sent me pictures. They're working so hard. They're just putting up the mirrors and the cabinets and the artwork, and it was just amazing. So this is superficial. You may feel a little tiny bit of burning because the numbing medicine seeps out and you can feel that it feels a little bit of burn. That up and just trimming the eyelid skin. How are you doing, Leah? Doing okay? You feel sleepy? Okay. Well, we'll wake you up when you're done. You're going to love your eyelids. Jamie, please grab it. Thank you.
Can you make like cat eye?
A cat eye? You're so funny. Now, let me have the little bipolar that isn't 50 feet long. There we go. That's perfect. Thank you so much. So just cauterize very lightly. Very good. You don't want to cauterize too much. It's not necessary, and then it requires extra recovery, trauma to the tissue. So just enough, but not too much, not too much. If they have any questions, Paola, I'm happy to answer questions. Let me turn your head this way just a little bit. Wonderful. So now I use that running
How
suture.
long it takes to do the eyes?
How long does it take to do the eyes? We finish with one. I'm going to be putting the stitch. Running subcuticular. And it just comes together so nicely. So thank you for joining. If you're just now joining us, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in Tampa and in the Villages, Florida. We have patients come from all across the country, even internationally, that see our videos, and when they watch our videos, they say, you know what, that's the doctor for me, that's the team for me. You realize what's possible, that you don't need a full facelift, that you can look natural, and get great results. We have permanent fillers. It'll feel goofy to open and close your eye when it's swollen, Leah, okay? So I promise that'll get better. As we say, you don't want to taste the chocolate cake before it's done baking. You gotta let that settle. Very good. Right on track. Doing procedures is one of the most relaxing things that I do because it's so predictable. It's something I really enjoy. It's very creative. I get to work with Jamie and with Paola. I mean, and, you know, the energy we give to Leah, she's a giver. She's going to go out there and give that energy back to the world. So it's just really an honor to be a part of this with you, Leah, and to do a great job for you.
When can I read?
When can you read? Well, you can read right away. The vision may be a little bit blurry for a few days because we put some Vaseline ointment on the top, and that ointment kind of gets goofy in the eyes a little. But I have patients watching TV and reading the same day. But it may be a little blurry. You might have to increase the font a little bit. Very good. So just this one stitch, and when we're done, in a week or two, we'll take that stitch and we trim one knot and we just slide it out just like this. So now I'm just going to put a little knot there. Perfect. And I put that there because otherwise you don't want to find the suture on the floor. We just put it right there and get rid of it. Thank you, thank you.
Dr. Rich, Nancy wants to know what we're doing today.
We're doing a local anesthesia facelift. And I'm going to come over to the other side. And we're doing upper blepharoplasty. And I'm going to use a little more of the lidocaine. Let me turn your head this way just a little bit. So we've already done the lidocaine. We've marked out the eye. So I'll add just a little bit more. Because we got some extra, so I'm going to use it. There's always more skin on one side than the other. Patients come to me and they say, well, I fell when I was young, or I had a car accident, and that's why they have one side different than the other. Or some patients have even, you know, if they've had a stroke in the past. But even if you've had none of that, most people have one side that's a little different than the other because that's just the way our facial anatomy is. Very, very normal. Very good. And this is what we call a fusiform incision. Tapered edges. And that comes together beautifully with my little one stitch running subcuticular. This is superficial to the orbicularis oculi. This is skin only. For most of our patients, it's not necessary to remove the muscle. Sometimes we will, but usually it's not necessary. And so there's no reason to take the muscle out and the fat out if you don't have to. You want to preserve. Let me turn your head a little bit this way, because as we get older, we're going to lose volume. Very good. Okay?
Yeah, I'm doing good. I'm just thinking that I think doing that would be good for me to drive better because
Oh yeah, a lot of my patients say their vision gets better
yeah, I have
because
a
it blocks the vision for many people.
I have a that little grayish uh vision. It's gonna be slim talking.
Yeah, your talking is goofy because we do the numbing medicine and it makes the lips goofy. Plus there's some swelling. So
Yeah.
you're not ready for your close-up yet. And as we say, you don't want to taste the chocolate cake before it's done baking.
So I can't laugh.
You can do what?
I cannot laugh.
You can laugh. You're a good laugher too. You won't hurt what I'm doing. It'll just feel goofy to laugh, that's all. And that's okay. So running subcuticular suture, you see how this comes through as just one stitch. Is all you need. Some people call this a preservation blepharoplasty, or preserving the muscle and preserving the fat.
What is the difference?
Well, traditionally they would just take skin, muscle, and fat from everybody, but that's not necessary. So we leave the muscle, we leave the fat because we want to preserve that volume. Everybody's going to hollow as we get older. So no need to take out tissue that's serving its purpose, and that makes us look younger when you preserve the volume. And if we hollow it too much, if it gets hollowed, you look older, so we don't want to do that. So we love to keep the volume, to give the volume, and if a patient already has hollowed anatomy, we can put the volume back. We have the permanent fillers, the temporary fillers, we got everything that you need. Very good. And again, gently I pull this through, and you can see it's one continuous thread. And I'm going to tie a little knot, and then we're going to tighten up on this side. Doesn't take that much longer. And we're all done. We're all done. This is not a mini lift. This is not a thread lift. This is an image lift. Local anesthesia facelift. Here in Tampa and the Villages, Florida. This is the safest way to do any facelifting treatment. And you look at her jawline, we're going to be doing some more tightening through here. I'm going to turn your head this way. Is that okay for you like that?
Oh, yeah.
And then how about here? Do you feel a little bit of numbing medicine or pinching, or not really?
Are you touching that?
I'm putting a little bit of numbing medicine here.
I'm not feeling.
Just put a little extra. I like to do just to be on the safe side. Perfect. Now 15, please. So I removed just a tiny bit of hair, but the incision hides very nicely here. You don't see it in this area, okay? So that's called the hair-sparing incision. Patients ask, well, is the hair going to go away? The answer is no, not if you do it the right way. Now, as we get older, our hair can thin, and if that happens, you need to check your thyroid levels and hormones. But facelift should not take away hair. Traditional facelifts used to remove that hair, and that whole area can look bald, which is not ideal.
Yeah, you do not touch. Right?
No, we don't do it that way. Not necessary. Everything's looking good. Thank you, Jamie. So traction, counter traction, and you can see when you're in the right tissue plane, it's easy. It's delightful. It's very anatomical that we can correct these aging changes predictably using proven, time-tested methods. There's tons of technologies out there that tighten, but you gotta be careful because sometimes those technologies can cause complications or create problems that you didn't need. They can create hollowing. There is no replacement for a good lift when we have the neck and the jawline. But we'll see what the future holds. Right now, there's No substitute.
So what do you think about the lip? The lip.
The lips?
I love the lip.
Oh,
I can't
yeah.
talk.
Patients love it when we do the lips. Family and friends, they never know you did it. It looks natural. Because everybody says the same thing about fillers. They say, don't give me too much.
I did that. What do you think about this one?
Yeah, how did it do for you?
No anesthesia. I didn't wanna.
How long ago did you have it done?
Last week, right, Jamie?
Were you happy with your results?
Yeah, I do.
It looks natural. It doesn't look overdone.
I feel that.
Yeah, Jen, our injector, did that for you.
Yeah,
So
Jen.
patients come in and they say, oh, is it going to be too much? The answer is no, it's not going to be too much if you let us do it. And we make you comfortable because it can be done with local anesthesia. It doesn't have to be painful to do the lips. Whenever I hear someone say, I had my lips done, it was so painful, I tell them, I'm so sorry. You should come here next time.
No, I didn't have. I asked her to not with the anesthesia. I didn't wanna.
Wow, you are tough.
I got without anesthesia.
Yeah, some patients have, obviously everybody has a little different pain tolerance, but even if you have a high or low pain tolerance, we can do treatments for you and make you feel comfortable. So I've lifted up this area, and Jamie, let's see, let me just elevate a little bit right here. Okay, and so now I'm going to do the smash plication. So Paola, if you want to do tripod or you want to finish this out or whatever you need to do, let us know. But we've got plenty of video that Leah can, you can watch your procedure. I'm very proud to be a part of this with Leah. And I'm very proud of your result. But of course, the smile always looks the best. And Leah has a great smile. And we help her look younger with the lift. And if somebody wants to look younger than what we can achieve with the lift, then you just have to act immature. It works. Okay, a little tight here. You feel it get tight. You doing okay, Paola?
Yeah, I'm doing all right.
Okay, thank you.
Mm-hmm.
Did you want one of them to tag you out, or?
I think I'll be okay.
Because we're wrapping up here. We're going to put the stitches, and then we'll put the wrap, and...
Nancy's asking, can you do multiple series at the same time? Or in the same session?
Yes, if they're all in the face. Now, some people will say, you know what, I mean, my face, nose, breast, tummy, all this together. Well, my recommendation is get a specialist for each one of those. Get a breast specialist, get a nose specialist, get a face specialist, get a tummy specialist. It sounds nice to do all that together, but then you're going to end up getting all at one time behind the ear, 6 to 10 hours of general anesthesia. That's too much in my opinion. Get the right specialist for each area and, do it one step at a time. So I can do multiple face treatments together, but for the body, I recommend people do that. Get the right specialist for what you're looking for, and not one person to just do everything. That's my recommendation. Thank you, that's a great question. So we're going to do similar to what we did on the other side. Paola, if you want to keep videoing, that's great, or if you need to wrap up, we can wrap up here. It's completely to you.
Okay.
I think I have a hot flash.
You can move around. What are you going to say again?
Feel hot.
We'll take your blanket off. I'll have them come in and step and take their blanket off. We just need to take off Leah's blanket in room 3. They're going to take that off for you here in just a moment.
I'm going to wrap up.
Put this little stitch. Okay, we went over to Texas. Oh, there we go. Thank you. We're just going to get our blanket off, please.
Mine looked off.
The bottom part of the blanket. Here. Yeah, she's going to take it right now. Is that better like that?
Oh, yeah, it's the hot flash.
Peyton? Yeah, there you go. Okay.
How's that?
Right.
A little bit more? You want to take more? That's fine.
No, I'm good.
Okay.
Is that good for you? Very good, very good. So it's easy for us to adjust if someone needs to move their blanket. Thank you, Peyton. Very easy. Does not disturb what we're doing. So as you can see, there's really no significant bleeding for most of our procedures. And if there is, then I'm going to cauterize, and then there's no bleeding. So that's the way we do it. It helps to have experience. So now I'm going to trim the skin. Say that again?
I said, this is awesome.
It actually is really awesome.
I was worried about it, and that it's easy.
You were worried that it would hurt?
Yeah.
Is it hurting?
No, I didn't feel anything.
Me neither. So now I'm preserving the tragus. I measure 3 times. 1, 2, 3. And then you can see how I shape the skin around the lobule. So I free up the lobule from the top of the lobule to the bottom of the lobule. And I'm going to trim that little area. Nice and easy. Leah, we'll have you home in time for dinner. And you know, liquids, fluids are the best to start with. If you're hungry and you want to eat, there's no restrictions. But you won't feel like doing heavy chewing because the wrap's going to feel tight. It'll feel, your teeth feel closed down and tight because it's, you know, everything's tightened up. And that lasts for a couple of days.
Okay. It's just me, my dog, and my cat.
Yeah, that's fine. So that comes together beautifully. Ragnell and Alfred, so I'm going to look one more time to see if there's anything that I would like to cauterize.
So we all done.
Well, I got to put a few more stitches, and then we put the wrap, and yes, we are done. We get right to it. A lot of patients say that, say we're done already.
You did my other eye too?
Oh, you wanted both eyes done? I'm just kidding with you. Yes, we did both eyes. Results. And I'm very proud of what I see today.
My husband's gonna FaceTime tonight.
Okay, that's fine.
I told him to not take a picture.
You're funny. We have the best patients and we have the funniest patients. Little cautery just to seal the blood vessels. Perfect. Release for me, please. So everything's laid on beautifully. So now I'm going to do the 2-0 vicryl. Thank you. That's good just as it is. These are the deep sutures that bring things together. You could almost just do this and it would heal beautifully. But on top of this, you know, belt and suspenders, we do that 5-0 chromic closure. Thank you. And then again on the anterior aspect of the tragus is that little bump in front of the ear canal. Tragus is the Latin word for goat. It's like a little billy goat's chin. And it's important to preserve that because if you take it away, that's one of the signs of a facelift. So you don't want to leave people with that. I've had patients who had lifts before and they were missing their tragus and I was able to recreate it for them. So we can reconstruct the tragus if need be. Beautiful. Now, posterior limb incision. Everything's looking good. Perfect. Thank you, Jamie. Right on the knot. The skin sutures, they melt away. Sometimes we'll take them out, but usually they fall away on their own. patients today are starting earlier because they don't want to wait for the advanced aging changes, so they stay ahead. And when you're asking the question, when is the right age to start? Well, if you're doing fillers, I mean, we all lose volume after the age of 20, 25. So it's good to start early. Everybody should protect from the sun. Sunscreen, sun protection for everybody. But come and get a consultation. You want to make sure you have your 5 to 10 year plan so that you know what the next steps are for you. Some say, well, I don't want to start too early. I don't want to go too far. Little baby steps in prevention. It's all about prevention. Maintenance and prevention is better than renovation. Thank you. And instant replay, we're going to put the stitches through here. So Leah, I'm so proud of you. Your neck and jawline, if you want to show them one more time without turning their paperwork out, or the before and after picture. Those are the before pictures. Leah is the after, the living after. Looks so good. Thank you. So you can see that Jamie follows me along with the suture, keeps the suture out of my way, and helps me to be very expeditious. Having a great team, I mean, there is no substitute for a great team.
You do have a great team.
Thank you, Leah. Thank you. That's very kind of you to say that, and it's one of the things I'm most proud of, truly, that the quality of people I get to work with, the type of people, it makes everything worthwhile. You know, there's a lot of people you can spend time with, but very, very high quality people here, and they really care about our patients, and it shows. And so that just is really one of my greatest accomplishments, to work with a team like we have here. And we're moving to our new office soon, 4221 West El Prado. The contractor's finishing up the finishing touches, and it will have an even better home for these amazing team members and our amazing patients.
When you're moving?
The moving truck is scheduled to come a week from Friday, and that date I think is probably going to happen. You know, sometimes those dates change and move, but don't worry, you'll be able to find us. We won't leave you.
I have a schedule for tomorrow.
Tomorrow you're coming here. You come to this office.
Yeah, and the 20.
Perfect. That's perfect. Yeah, that'll be back here. So one more time, we have our seminar at Sun City tomorrow. Would love to see you there. Seminar in Brownwood next week. You'll love our seminars. Get a copy of our book. We guarantee we can make you look younger. You can download it on Amazon. Just look up my name, Rich Castellano, MD. And we keep it that simple. No secrets, except do 4,000 and you get to be amazing at something.
Dr. Rich, somebody asked what kind of relaxation medications you
We
use
use
for
Valium.
anxious patients.
It's like you had a few cocktails. That's a great question. And some take one tablet, some take a couple. Whatever you need, we'll give you. If you drink alcohol, you will have a higher tolerance. But even those patients still will do well with the Valium. And it always works, and some people just need a little more of a dose. And Valium is a safe medicine. It's a medicine that people take at home completely unsupervised to help them sleep or relax. So, but here you're supervised. We monitor your heart rate, we monitor oxygen, we monitor blood pressure. Everything's looking good. Perfect. Few stitches here, a few more under the chin, and then we're all done.
How long it takes for me to wash my hair?
To wash your hair, you can wash your hair at 48 hours. Where you take the wrap off. Tomorrow we'll change the wrap for you, but at 48 hours, you take the wrap off at home. You can jump into the shower, soap and water. Don't soak, but you can get wet. You towel dry, and then you put the Hibiclens and the Vaseline, and then a little bit of gauze in the wrap. So now I'm going to turn your chin all the way to the middle and chin all the way up for me, please. That's perfect. Very good. Okay, so, and as I'm looking, it just looks picture perfect, so I'm going to put a little bit of the gauze here. We just check to make sure there's no additional fluid.
It feels like I did a food facial.
Haha. It looks so good. You're going to love your neck and jawline. And your family and friends, they're not going to know what you did unless you tell them. Or if you show them the video. But as you can see, there's no significant fluid collection. So that's great. Release for me, please, Jamie. So that just looks beautiful. I love what I see. So now you can do the HIBA cleanse. And I'm going to, I like to do a deep 2 vicral suture here. And then this brings the edges together.
Dr. Rich, somebody's asking if we do any IV meds during surgery.
It's not necessary to do IV medication during the procedure. That's a great question. The answer is not necessary. Leah, do you feel a little pinch here?
No.
We use local anesthesia and we use vocal anesthesia. You know, patients really appreciate it when you talk to them, when they hear your voice, when they hear the doctor talking and the doctor sounds calm and collected, the patient says, well, I feel better. And so, local anesthesia and vocal anesthesia. Because once you're numb, you can't tell, I mean, there's always excitement in the air, right? And that's normal. But once you're numb, you can't tell what we're doing. A lot of patients fall asleep and we wake them up when they're done. That sounds like it was someone with medical background asking about that. Yeah, not necessary to do IV medication. Great question. Let us know where you're coming from. Give us a call. Happy to set up a 5 to 10 year plan for you. We have the smartest patients. They look us up on the internet, they find us, they do their homework. For the patients that do their homework, they come to us.
I didn't look for this for many years.
For a while, huh?
I saw in Texas, then I didn't go for it. But I saw yours. It kind of changed my mind.
Okay, so we're completely done. Hopefully that wasn't too bad, was it?
No,
Congratulations.
I'm just ready to get up.
Yeah, we're gonna put the wrap on first.
I'm ready to
You
get
want
up.
to show the wrap towel or we wrap it up? It's up to you.
Sure.
We're all good to go? Yeah. Okay, thank you all for watching. I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Look at her neck here one more time. Look at the neck and then look over there where you see her pictures and what a nice difference. We are so proud of Leah. What a tremendous, and then you see that. And one more time, show how sharp the neck and jawline is here. That's just beautiful. So congratulations. We'll see you guys in the next video. Thank you for watching.